Welcome back. Joining us now is Africa 54 health correspondent Linord Moudou. What do you have for us today, Linord?
Hello, Vincent. Hello, everyone. Every year, war takes the lives of millions of unarmed people worldwide. The consequences of conflict on health are wide-ranging. They include diseases, amputation, and the disruption of health services. Emergency is an independent non-profit organization working to provide care for victims of war-torn countries. And joining us from our studios in New York is Eric Talbert, Executive Director of Emergency USA. Mr. Talbert, welcome to the program.
Thank you, Linord.
Your work actually was featured last year in a documentary called Open Heart, which was nominated for an Oscar, about a hospital that provides surgeries to children. Tell us about this specialized care that you provide in Sudan.
Yes, there's a young girl named Angie. She's only 6. She was living in Rwanda, and she caught strep throat. Very common for kids these age to get strep throat, but it went undiagnosed and untreated and developed into heart disease. So we were able to transfer her from Rwanda across the continent to our hospital in Sudan, where Emergency has built a high standard free of charge cardiac hospital. She's able to receive that services, return home, and be with her friends and family.
This is a one-of-a-kind hospital in the region, right, that provides this type of surgery?
That's right. The Slum Center is the only high standard free of charge cardiac hospital in the entire region. So we worked really hard to provide health solutions region-wide. And to learn more about our hospital, people can visit our website for Emergency USA at www.emergencyusa.org. Or if any of your listeners might need treatment, they can find more information there.
Okay, and then they can also visit our website for more. Let's go now to West Africa and Sierra Leone, where you work extensively, actually. Can you tell us about what is happening there? The country has ended its conflict more than 10 years ago. What is your area of focus now?
That's right. Emergency built our surgical center in Sierra Leone back in 2001 during the conflict. Since then, we've been able to treat over 400,000 patients free of charge. And part of what we're seeing today, in addition to the ongoing surgical needs, is also children will accidentally ingest caustic lye, which is made homemade soap, and it causes severe burns on the esophagus. So we've developed a special program in partnership with the local needs to provide immediate surgical intervention as well as ongoing treatment, and able to provide these kids with an ongoing life and be able to go back to school.
So where do you find the proper location for the type of services that you provide when you go in a country? Is it better in a rural area or near the conflict zone?
We typically are near the conflict zones as well as the capital city, because we need access to the international airport for medical supplies, because all of our services are free of charge. So it's important that we have high quality supplies and equipment for our hospital, as well as be able to transfer these patients. So if they're coming all the way across the continent from Sierra Leone to Sudan or from other areas, that we need to be able to rush them. Sometimes there's an immediate need to rush them to the hospital. So that's typically where we build our centers.
So what have you found now that you've been working in Sierra Leone after many years of the conflict? Where do you see the urgencies in terms of the healthcare system?
Primarily in pediatrics. So on our hospital grounds, where we also have the surgical center, there's also a pediatric center, and a large part of the population of Sierra Leone is the youth. And so we're working on supporting new and young moms as be able to provide treatment prevention, so we can provide access to penicillin free of charge, so when kids do get strep throat, it doesn't develop into heart disease, as well as other basic primary care for newborns and for children, so they can stay healthy and go to school.
Okay, Mr. Talbot, that's all the time we have. Thank you so much. And your organization also works in other countries like the Central African Republic. Thank you for joining us from New York.
Oh, thank you, Linord.
And that was Eric Talbert, Executive Director of Emergency USA.